Bismillahirrahmanirrahim. Not all storms come to disrupt your life, some come to clear your path. Today, the topic of my presentation is Introduction of Disaster and Disaster Management Cycle, and I am presenting it under kind supervision of Professor Dr. Saira Afzal. Learning outlines are introduction to disaster, types of disaster, levels of disaster, phases of disaster, disaster management, disaster management cycle, recent updates, and MCQs. Learning outcomes. In the end of presentation, participants would be able to describe types, phases of disaster, and disaster management cycle. Introduction. Disaster is a sudden calamitous event bringing great damage, loss, and destruction and devastation to life and property. The damage caused by disasters is immeasurable and varies with the geographical location, climate, and the type of the earth's surface or degree of vulnerability. This influences the mental, social, economic, political, and cultural state of the affected area. Now, these are the multiple effects of the disaster, each letter of this word shows like destruction, incidents, sufferings, administrative financial failure, sentiments, tragedies, eruption of communicable diseases, and include research program and its implementation. Definition of disaster. WHO defines it as any occurrence that causes damage, ecological disruption, loss of human life, deterioration of human and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. Red Cross defines it as an occurrence such as hurricane, tornado, storm, flood, earthquake, drought, famine, fire, explosion, or any other situation that causes human suffering or creates human that the victims cannot alleviate without assistance. Now, types of disaster. I will just touch the types and it will be discussed in detail in upcoming presentation. On the basis of origin or causes, there are natural disasters and man-made disasters. In natural disasters, there are hydrometeorological disaster, geographical disaster, biological disaster. These are the very common natural disasters like earthquake, wildfire, flooding, drought. And man-made disaster, this is technological disaster or environmental degradation. Then comes the division on the basis of speed of onset, sudden onset disasters or slow onset disasters. Levels of disasters. There are three levels. First level is if the organization, agency, or community is able to contain the event and respond effectively utilizing its own resources. Level 2, if the disaster requires assistance from external sources, but these can be obtained from nearby agencies. And the third level is if the disaster is of a magnitude that exceeds the capacity of the local community or origin and requires assistance from state level or even federal assets. Now, phases of disaster. There are three phases: pre-impact phase, impact phase, and post-impact phase. Pre-impact phase, it is the initial phase of the disaster prior to the actual occurrence. A warning is given at the sign of the first possible danger to a community with the aid of a weather networks and satellite. Many meteorological disasters can be predicted. This is the period when the emergency preparedness plan is put into effective emergency center. Emergency centers are opened by the local civil detention authority. Communication is a very important factor during this phase. Disaster personnel will call on amateur radio operators and television stations. The role of nurse in this warning phase is to assist in preparing shelters and emergency aid stations and establishing contact with other emergency service groups. Then comes the impact phase. This is the phase when actually disaster happens. It is a type of enduring hardship or injury and of trying to survive. This phase may last for several minutes. For example, after an earthquake, plane crash, or explosion, or for days or weeks, like flood, famine, or epidemic. This phase continues until the threat of further destruction has passed and emergency plan is in effect. This is the time when the Emergency Operations Center is established and put in operation. It serves as the center for communication and other government agencies of healthcare providers to staff shelters. Every shelter has a nurse as a member of disaster action team. The nurse is responsible for psychological support to victims in the shelter. Then comes a post-impact phase. This is the phase in which recovery begins, like during the emergency phase, and ends with the return of normal community order and functioning. For persons in the impact area, this phase may last a lifetime. For example, victims of the atomic bomb of Hiroshima. Now, moving on to second topic of my presentation, that is disaster management. It is defined as the organization and management of resources and responsibilities for dealing with all humanitarian aspects of emergencies, particularly preparedness, response, and recovery in order to lessen the impact of disasters. Now, disaster management cycle. These are the four main phases. First is mitigation, then comes preparedness, response, and recovery. Let's discuss each. Now, what is mitigation? It is the minimizing the effects of disaster. Preparedness is planning how to respond, and response is efforts to minimize the hazards created by disaster. Recovery is returning the community to normal. First is mitigation. Mitigation reduces the impact of disaster by supporting protection and prevention activities, easing response, and speeding recovery to create better prepared and more resilient communities. There are two types of mitigation: structural mitigation, non-structural mitigation. In structural mitigation, construction projects which reduce economic and social impacts are included. For example, dams, windbreaks, terracing, and hazard resistant buildings. Like this is the example of earthquake resistant building in which cross bracing, shear walls, and shock absorbers are used in constructing the building to protect from earthquake effects. Then comes the non-structural mitigation or activities includes policies and practices which raise awareness of hazards or encourage developments to reduce the impact of disasters. That is public awareness, different types of insurance, family plans for some emergency situations. Now, mitigation includes reviewing building codes, vulnerability analysis updates, zoning and land use management and planning, reviewing of building use regulations and safety codes, implementing preventive health measures, political intervention and commitment, and public awareness. Strategies include hazard identification and vulnerability analysis, various mitigation strategies or measures, for example, varieties of crops that are more wind, flood, or drought resistant can often be introduced in areas prone to floods, drought, and cyclones. Development initiatives for countries faced with disasters. These are partnership, that is close collaboration among donors, governments, communities, non-governmental organizations, the private sector, and universities. Flexibility. Development agencies must be efficient and flexible, adaptable to local environments, and capable of adjusting to changing conditions and seizing opportunities when they arise. Selectivity. Resources are the public asset that must be invested prudently to achieve maximum impact. Then comes preparedness. It is a planning, training, and educational activities for things that can't be mitigated. During the preparedness phase of the disaster management cycle, measures are taken to reduce the minimum level possible of loss in human life and other damage through the organization of prompt and efficient actions of response and rehabilitation, such as practicing earthquake and fire drills. It involves planning, organizing, training, interaction, and other organizations and related interaction with other organizations and related agencies, allocation and placement, and plan testing. Important areas: develop and test warning systems regularly and plan measures to be taken during a disaster alert period to minimize potential loss of life and physical damage. Educate and train officials in the population at risk to respond to the disaster. Train first aid and emergency response teams. Establish emergency response policies, standards, organizational arrangements, and operational plans to be followed by emergency workers and other response entities after a disaster. Now, measures include preparedness plans, emergency training, as being shown in the picture, warning systems, emergency communication systems, and public information education. Now, disaster risk reduction. It forms the action plan to be implemented before, during, and after disasters. The International Federation of Red Cross and Red Crescent Societies define risk reduction as physical measures to reduce the vulnerability and exposure of infrastructure to natural hazards as well and to provide coping and adaptive infrastructure in case of a disaster event. This is one of the examples shown in the picture of disaster risk reduction in climate change adoption in Vietnam. This is the uh, land that is being constructed to mitigate the effects of flood or water influence. Then comes disaster risk reduction recommendations for countries which do not have a robust disaster preparedness plan. It includes policy, planning, and capacity building in disaster management, physical prevention, for example, building sea walls against a surge of flood shelters during flood events, capacity building and institutional and systemic level in disaster preparedness, and continued provision of food, potable water, and healthcare. Then comes the third phase, that is response. It is the immediate aftermath of a disaster when business is not as usual. The response phase includes the mobilization of the necessary emergency services and first responders in the disaster area. This is likely to include a first wave of core emergency services such as firefighters, police, and ambulance crews. Healthcare intervention response starts here. The focus in the response phase is on meeting the basic needs of the victims until sustainable community has been achieved. It also involves initial repairs to damaged infrastructure. Response activities are post activities geared towards providing emergency assistance, speeding recovery operations, returning systems to normal level, reducing probability of additional injuries or damage. Then the last phase is recovery. It is the long-term aftermath of a disaster when restoration efforts are in addition to regular services. The aim of the recovery phase is to restore the affected area to its previous state. For example, lifelines, health and communication facilities, as well as utility systems. And it is the beginning of the repair of physical, social, and economic damage. It includes continued health monitor and care, reconstruction of vital facilities, counseling program grants, and it may include economic impact studies. Now, moving on to disaster triage. Disaster triage, the triage word is from French word trial, which means to sort out or to choose. The Baron Jean Leray, who was a chief surgeon of Napoleon, is credited with organizing the first triage system. It is a process of determining the priority of patients' treatment based on the severity of their condition. It is a process of sorting people based on their need for immediate medical treatment as compared to their chance of benefiting from such care. Um, Now, triage is a process which places the right person in the right place at the right time to receive the right level of care. And it is a process, or we can say that it's a process of prioritizing which patients are to be treated first, and is the cornerstone of good disaster management in terms of judicious use of resources. Aims of triage system. Aims are to sort patients based on needs for immediate care, to recognize futility. Medical needs will outstrip the immediately available resources. Additional resources will become available given enough time. Purpose to inadequate resources to meet immediate needs, infrastructure limitations, inadequate hazard preparation, limited transport capabilities, multiple agencies responding, hospital resources overwhelmed. Now, there are two main types of triage: simple triage, advanced triage. A simple triage is used in a scene of mass casualty in order to sort patients into those who need critical attention and immediate support to the hospital and those with less serious injuries. This step can be started before transportation becomes available. The categorization of patients based on the severity of their injuries can be added with the use of printed triage tags or color flagging. And START, that is, which is the acronym for Simple Triage and Rapid Treatment, is a simple triage system that can be performed by lightly trained and emergency personnel in emergencies. It separates the injured into four categories or groups. Zero, the disease who are beyond help. One, the injured who can be helped by immediate transportation. Two is the injured whose transport can be delayed, and three is those with minor injuries who needs less help. Then comes advanced triage. In advanced triage, doctors and specially trained nurses may decide that some seriously injured people should not receive advanced care because they are unlikely to survive. In order to increase the chances for others with higher likelihood. There are four color codings in this triage system, that is red for immediate, black for disease, yellow for delayed, and green for minor. Now, red is the first priority, which is for the people that may survive if given immediate, simple, life-saving measures. Yellow or second category is that the patient should survive if given care within a few hours. And third, green, walking wounded, minor injuries that do not require rapid care. And black is that for people who, or a person who is diseased or severely injured patient unlikely to survive. Now moving on to recent updates. This was an article published in 2019 on current capacities, preparedness, and needs of local institutions in dealing with disaster risk reduction in Khyber Pakhtunkhwa, Pakistan. Local institutions could play an essential role in providing first-hand rescue and support to communities in reducing the impacts and vulnerability to natural disasters such as floods. Keeping in view the importance of local institutions, Pakistan has established disaster management authorities both at national and provincial level to calibrate with local institutions in dealing with natural disasters. However, little is known about the current level of preparedness and capacity of local institutions and capacity building gaps in managing disasters at the local scale. So, in order to fill this gap, this study was conducted and 40 key informants from 19 institutions working at local levels to identify the current capacities, preparedness, and gaps in disaster management cycle of local institutions in KPK, Pakistan, using five indicator disaster preparedness pillar. Uh, um, and disaster this was another article that is disaster preparedness and management in Pakistan. It was a systematic review. The study findings revealed that the majority of the local institutions were underprepared in terms of awareness and training, human resources, financial resources, infrastructure, equipment, and coordination. And the results further indicated that the existing preparedness capacity gaps could be bridged through capacity building, training, technical support, and financial capacity and infrastructure building. Additionally, to achieve a higher level of disaster preparedness, the government should establish direct linkages among all institutions which are actively involved and engaged in disaster risk reduction, especially local institutions. Now, this is an article which is on disaster preparedness and management in Pakistan. According to it, since inception about 66 years ago, Pakistan has experienced a variety of both natural and man-made disasters, like earthquakes in 2005 and 2015, and widespread flooding in 2010. Pakistan has also experienced a range of politically motivated violence, bombings in urban areas, as well as mass shootings. Such events generate many casualties. To minimize the loss of life, well coordinated pre hospital and in hospital response to disaster is required. And the aim of this study was to identify all the existing peer-reviewed medical literature on pre-hospital and in-hospital disaster preparedness and management in Pakistan. The reviewed articles show a lack of data regarding disaster management in Pakistan, and almost all articles unanimously state the scarcity of planned pre-hospital and in-hospital management related to both man-made as well as natural disasters. Now, this is a third article on schools flood emergency preparedness in KPK, Pakistan. This study examined the emergency preparedness activities of 20 schools in 4 districts of KPK that had recently been severely affected by floods. Through face-to-face interviews and a structured questionnaire, data was collected on the 4 pillars of emergency preparedness, that is emergency planning, preparation measures, safe school facilities, and hazard education and training. The study revealed that the majority of the sample schools had experienced more than one natural hazard induced disaster, predominantly flooding. Yet, despite this, had not undertaken adequate emergency preparedness activities. There are particular gaps with regards to plans for students with disabilities, the continuity of school operations after disaster, the presence of maps to identify evacuation routes, the availability of emergency equipment and resources, disaster preparedness guidelines, and psychological first aid and crisis counseling. Now coming to multiple choice questions. Disaster, first MCQ. Disaster management is a process of effectively preparing for and responding to disasters. It is aimed at resettling people in the closest unaffected urban area, collection of valuable data for future management objectives, strengthening sewage and drinking water treatment facilities to resist the impact of a future disaster, or restoring a community's services, facilities, and residences to pre-disaster levels.
D.
Yes, right answer is D, because it is actually aimed at that restoring a community's services or their condition to pre-disaster levels. Now, second MCQ, effective hazard management largely relies on government agencies, emergency responses, pre-disaster planning, large number of hospitals.
C.
Yes, right. Option is C. Although hazard management relies on all of the following 4 options, but mainly it relies on pre-disaster planning. Third MCQ, the extent to which a community, structure, services, or geographic area is likely to be damaged or disrupted by the impact of a particular hazard is termed as capacity, vulnerability, risk, hazard assessment.
B.
Yes, right option is B, because vulnerability is the extent to which a community structure or their services is likely to be damaged or disrupted by the impact of any hazard. Vulnerability analysis is assessing the threats from potential hazards to the population and to infrastructure. Vulnerability analysis comes in which part of the disaster management cycle? Mitigation, preparedness, response, recovery.
B.
No, the right answer is mitigation, which was the first step of the disaster management cycle. The main strategy of the mitigation phase is vulnerability analysis or hazard identification. MCQ number 5. In disaster management, mitigation measures involve government action and administration, community action and administration, military action and administration, effective communication and administration.
D.
Yes, right option is B, that is community action and administration. MCQ number 6. Triage is the process of deciding which patient should be treated first based on how sick or seriously injured they are. Choose the correct statement regarding triage. Timely access to emergency care can improve patient outcome. Patient is triaged according to complexity of illness. The primary approach survey is used to identify life-threatening condition at triage. Or D, if clinical status changes, then that will impact the triage category. Retriage should be done.
C.
No, the right option is B, because patient is triaged according to the severity of illness or the conditions. Patient is graded according to it. MCQ number 7. One triage method is START. What does START stand for? Simple triage and rapid treatment, START tasking and rapid tracking, simple tasking and rapid termination, START talking and reassess treatment.
A.
Yes, right option is A. Because there were the two types of triage, simple and advanced, and one of the main strategy of simple triage was START, that is simple triage and rapid treatment. MCQ number 8. Developing and practicing an emergency plan occurs during which phase of the disaster management? Preparedness, response, recovery, mitigation.
A.
Yes, A, preparedness. As we have already discussed that in this emergency plans, they are being practiced like earthquake drills and other types of practices. MCQ number 9. Mr. Salim, a 38-year-old, has cut his left arm with an industrial injury. He was brought to the emergency department by a workmate. He has a deep laceration of about 10 centimeters to the inner aspect of his arm. The wound was bleeding quite a bit, but the blood loss has been controlled with a firm bandage. He looks pale and is sweating. His heart rate is 130 beats per minute and his respiratory rate is 30 beats per minute. Where should be triaged? He should be triaged to red, green, black, or yellow?
A.
Yellow.
Yellow. Yellow is the right option because in this patient, as yellow is for the patients who should survive if given care within a few hours. And here we can see that his bleeding was controlled with just a firm bandage, and his condition is reversible if prompt management is done. Last MCQ. Following phase focuses on restoring the social, physical, economical, and organizational infrastructure of a community after an emergency. Response, recovery, mitigation, preparedness.
B.
Yes, B is the right option, recovery, because it is the restoring of the social, physical, and other of a community to the pre-disaster stage. This is the key of my MCQs. These are the references. Thank you.
Thank you very much. Very nice presentation, Dr. Meha. However, I have seen that within disaster and emergency plans, there are many more points that can be added. And if you go to the book that is Paramount Textbook of Community Medicine and Public Health, that has been edited by myself and Dr. Sabeen Jalal, you can see that there are many other important aspects of disaster management, emergency response, preparedness, and execution of those plans have been documented. The most important part that has been missed in today's presentation was that after the execution, there is a continuous system of evaluation, monitoring, and to revisit all those plans and make up a policy and planning for having the improvement in emergency response. And that is the essence by which many disasters and accidents have been prevented, have been managed successfully, and in catastrophes like earthquakes and floods, many lives have been saved and many precious lives have been prevented to get into epidemics, etc. So I would like you to please add into
Okay,
the
ma'am.
reference in the reference you must write about the textbook, and
Okay.
also go to that chapter. It has been written by the most knowledgeable renowned professors of our times. Many of them have left this world, but their wisdom has been put on the paper and it has been preserved for the next generations, so that they can get wisdom and knowledge about the disaster management, emergency response, and etc. I have put 65 professors from different provinces, cities, to be included in that write-up, because when we were approaching different professors, some were also writing. There were more than two professors who were writing on the same topic. So, as an editor, we have combined all those writings, and we have given the due credit to all those professors. There are 65 different experts and professors who have contributed. So if you go to that chapter, you would see that how the things can be improved and it can be added in these slides. The
Okay, ma'am.
second
I will.
important, thank you so much. The second important request is from Dr. Mehreen, and she is saying that on third, as this roster is ending up, so we have to make a new roster. Yes, I totally agree with her, and I applaud her great work and the work of all the students who have worked very hard in making that presentation. And to appreciate you all, I think a 3 days break must be given to you, and you can take rest as well as you can take time out for your recreational activities, family time. And for 3 days, there from 4, 5, 6, there would be a break, and then we would start our classes, inshallah, from 7th January 2022. And again, we would have this roster about each presentation would be recorded, and it would be available for your reference, and to review any content that you think that is important for you.
Okay.
It's the
Thank